This is a download from BFM 89.9, the business station.
Good afternoon and welcome to Health and Living with me, T. Shao-Ik. The National Health and Morbidity Survey 2019 is being conducted between April and September of this year, and this is a national survey that provides data on the state of the country's health. And very often we quote the statistics from the NHMS when we discuss the prevalence of diseases, when we talk about things like obesity, heart disease, diabetes, and we always talk about, the NHMS shows that, X percentage of Malaysians have it. But what do we really know what these statistics mean? How did they come about? How were they collected? And because the survey is going on now, what should you expect if officers from the Ministry of Health come knocking on your door to collect information for the survey? So I have in the studio with me Principal Investigator of the National Health and Morbidity Survey for this year, Dr. Shubash Shander Ganapathy, as well as En Ahmad Ali Zainuddin, nutritionist, and they're both from the National Institutes of Health in the Ministry of Health. So if you have any questions about this survey, if you'd like to know what's going to take place, or perhaps what the survey means to you, you can call us at 0377332900, WhatsApp us at 018-789-8899, or tweet us at BFM Radio. Good afternoon, Dr. Shubash and Ali. How are you both today?
Yeah, good. Thank you.
Okay, so I think it would be a good place to start by understanding what exactly is the National Health and Morbidity Survey, this big name that we are talking about. What does the survey actually try to do, Dr. Shubash?
Okay, good afternoon, Sharik. Yes, the National Health and Morbidity Survey is actually a survey that we conduct mainly to collect data on the situation of the health and health parameters of the Malaysian population. Mm-hmm. So what we do is we go house to house in order to interview the patients. We do clinical examinations such as take the blood pressure, do a finger prick blood test in order to get accurate information on what is the health status of the Malaysian population. Mm. So the National Health and Morbidity Survey actually started in 1986. This was the very first survey that was done. Subsequently, we repeated the survey in 1996 and then 2006.
So every 10 years at that time?
Every 10 years, correct. It started out as a plan for every 10 years. Mm-hmm. But after 2006, the Ministry of Health realized that the importance of obtaining such a data, and not only that, we needed accurate data and more up-to-date data when we want to plan for our services, when we want to plan for our health needs. So in 2011, a decision was made that the National Health and Morbidity Survey will be done every 4 years regarding non-communicable diseases and healthcare demand. Mm-hmm. So after 2011, which was the fourth one, we had repeated the same one again in 2015, and now we are at the sixth cycle in 2019.
So that's the every 4-year break.
4-year break, yes.
Okay. And you say that you need updated data so that you can plan for services. What exactly do you mean? How do you use the results from the survey?
The results that we obtain, we get the prevalence of diseases and the risk factors for the non-communicable diseases. This includes like diabetic, hypertension, high cholesterol, and major risk factors such as smoking, obesity, and alcohol intake. These are all very important numbers for us. Mm-hmm. Beyond that, when we do the survey at regular intervals, we are able to monitor the trends of these diseases. We want to see whether it's going up, going down, and this is extremely important for us to monitor and evaluate our current health situation and also our programs and policies.
Ali, in terms of it going up or down, what do we see now? What do we know about the trends of these diseases?
This obesity, when we see at the problem, the trend is increasing since 2006 to 2011, and then based on our studies, our survey, and then we take action and do the intervention and all that from the program. And then from now we can see that is being slowing down from 2011 to 2015.
Okay.
Yeah, and when we look at the global nutrition report in 2006, we are now no more the fattest. The fattest, what we call the fattest in the country in the Asian. So we are improving. So there are other countries.
Oh, okay.
Higher.
Because we still hear of these results, these statistics that we have the highest obesity rates.
Previously, but the current report in the 2006 from the Global Nutrition Report, we are going down. From the first to the second.
Okay, something some progress.
Of, yeah.
It would be very worrying if we are still going up.
Yeah.
Dr. Shubash, you are the principal investigator for the survey. What does that mean? What do you do?
Well, as the principal investigator, my job is to plan out for the survey. This includes all the preparation, what we are going to do, what we are going to ask, how many people we are going to ask, and how do we carry out. So as this survey involves about 30,000 people being interviewed for this survey, and it covers all over Malaysia, all our 13 states and 3 federal territories. So this is the logistic requirements for this is actually quite a massive amount. And we require to do this is within a 3 months period. We do not want to drag the data collection for 6 months or 1 year just to collect data. So we have to arrange for all this, and as the principal investigator, it falls upon me to do these arrangements. But of course, I have a whole team with me in Institute of Public Health to work together.
And Ali, as the nutritionist, what is your role?
Yeah, in the NHMS now for this year, I become a central field supervisor for the survey. And then my task is to monitor what's going on the field. There are a few other person in charge in the field, in the central, like mine in charge in the Borneo for Sabah, Sarawak and Labuan. And then so the monitoring is when they go for data collection for 3 months, I will make sure them to follow the let's say the Gantt chart, and then the progress that we are set for them. And then what is the issue on the field that we need to solve.
Okay. So 30,000 Malaysians that you will, who will be part of this survey, who will be covered under the survey, how do you choose these participants? And how do you ensure that you are choosing them in equal representation of all the different population groups in Malaysia?
Okay, we have to cover we do cover all the states and federal territories, like how I said. And within each state, we would then select what we call as enumeration blocks. This is a small area of a collection of houses. This is determined by Department of Statistics of Malaysia. So we obtain these, which they select for us a fixed number of areas, our clusters is which we call it. And from there, we randomly select a certain number of houses to be included in the survey. So usually, we do not specifically choose a specific group, neither do we deny any specific group. But when we are taking into account like about 30,000 people are being selected, we believe that the random process will then give us an equal representation of the whole Malaysian population.
Actually, we are selecting the house, and then the respondent is the one, everybody is in the house, is in the house.
Okay, so of a household of 5 people, you will survey every single person in the household?
In the house, correct.
Okay, all right. And I mean, in terms of distribution between urban and rural, age groups, is that fairly distributed?
We take it proportionate to each state. If the population is mainly located like 80% in urban areas and 20% in rural areas, we would then select 80% of the houses from the urban areas and the remaining 20%.
I see.
And the age group, because we are taking everyone in the house, then when it comes to age group, ethnicity, occupation, and all this. We select all of them, and we get quite a good representation at the end of the day.
Okay. Ali, what about, communities that may be hard to reach, Orang Asli communities or the really remote communities in Sabah and Sarawak? It must be a challenge to reach them.
Okay, for the NHMS, we only decide for strata 6. So for strata 6, so it's not for the very rural. So
what does strata 6 mean?
It's a reachable. How do you reach from? How can you access to their house?
Okay.
So within 15 minutes or 30 minutes. So like after the strata 6, maybe it's very, very rural. So that one is not included in the National Health and Mobility Survey.
I see.
So mainly they will cover for the main ethnicity.
Yep.
But for the rural, maybe Dr. Shubash can elaborate.
Like strata 6 is actually about 2 hours away from a main town center.
So
which
that's
actually
your
covers
radius.
a large amount of rural areas are actually being covered here. Usually the only areas that are further away than that has been located in Sabah and Sarawak. So we do cover almost all areas. We do not select Orang Asli places or Felda groups or anything like that. It's all part of our survey. And this year around, we are actually together with cooperation from the Sarawak State Health Department. We are going to the interior areas of Sarawak for this year's survey.
And so this is a new development?
One, yes. Okay. We're doing it for the first time this year.
All right.
So we are looking at what is the situation and the health conditions of these rural areas. And because of, usually we do not include them, is because of the accessibility and logistic problems that we have. We need to send our data collectors in. But with the help of the State Health Department, this has been made possible this year. And we are very interested to know what's happening there.
I mean, in the past, if you haven't been able to access certain very rural areas, and if those communities that are beyond the strata 6, do those limitations mean that certain groups are being excluded from a national survey?
Well, we do not deny that they are being excluded. However, it's a very small number of people who are located in this area. And we must take into account as well that like any study and any survey or any research that is being done, we do have some limitations on what we can do and what we can't do. So we are able to do this. This is our feasibility on it, and we report it as.
Okay. When we come back from the break, I will ask Dr. Shubash and Ali more about this year's survey. So what will the scope be? And also what to expect. What actually happens when you're conducting the survey? What are the field officers doing? How you can help if you are one of the households randomly chosen to participate. I'm speaking to Dr. Shubash Shander Ganapathy as well as Ahmad Ali Zainuddin. They're both from the National Institutes of Health, and they're involved in the National Health and Morbidity Survey 2019. When we come back, as I said, we'll find out more about the scope of this year's survey. Don't go anywhere, right here on BFM 89.9. Good afternoon and welcome back to Health and Living with me, T. Shao Ik. I am exploring the National Health and Morbidity Survey 2019 in today's segment, and I'm speaking to Dr. Shubash Shander Ganapathy, the principal investigator of the survey, as well as Ahmad Ali Zainuddin, nutritionist. They're both from the National Institutes of Health, Ministry of Health, which is the body that is conducting this survey. So, I've been talking about what is the objective of doing a national survey like this. You are reaching 30,000 Malaysians, randomly selected all across the country, and as you said earlier, Dr. Shubash, the data, we often quote the data just to scare ourselves, heart disease is on the rise and things like that, but you are actually using it to plan for services, for interventions, in order to reduce the prevalence of the diseases. So what will be the scope of this year's survey? What will you be trying to look at?
Okay. This year we are looking at a few key areas, which include one is the non-communicable diseases. These include major non-communicable diseases like diabetic, hypertension, cholesterol, and together with it, its risk factors, which is like smoking, physical activity, alcohol intake.
Yep.
And beyond that, we are also looking at healthcare demand. Now, healthcare demand is basically what is the demand for health among the Malaysian population.
Okay.
So how much do they visit a government clinic or a private clinic? How often do they need to use these services? And how much do they pay for these services? And what are the other problems related to it? We are also exploring things like how many people are requiring home care nursing, how many people are taking it despite being at home, they are actually nursing someone who's sick at home.
Right.
So these all are directly and indirectly affecting our health system.
Okay.
So these are areas covered under healthcare demand. And beyond that, we're also looking at health literacy. Health literacy is how literate are they about health? Because we want the population, if we give some information, they must be able to understand and evaluate and make the correct decision. We can just throw tons of information, but if they are not going to process this and understand this is end of the day going to be quite a bit of a waste. So we want to see among the Malaysian population, the general public, how well they can understand things. So this actually becomes also a very important aspect on how we want to plan for our services.
In terms of health literacy, is this something that you've looked at in the previous surveys as well? 2015, 2011?
2015 with it, yes. Yeah,
okay.
We are repeating
so
it.
This would be only your second time. I'm just wondering whether there's any improvement in terms of health literacy with the kind of engagement that the ministry is doing to educate people.
Yes, we hope to see an improvement with the results of this year.
So, Ali, what will happen during a visit to a household in order for you to find out all these details? Can you walk us through what a visit will look like?
I see. Okay. A trained data collection team will visit selected house sometime between July to September, and there will be 70 trained team from the MOH, and then they will visit the house at least 3 times at a different time. For example, in the morning, evening, and at the night. And then we go to the Great Line to obtain our participant based on available and preferred time.
Okay, also 3 times would be if nobody's at home in the morning, they will go again in the afternoon.
Yeah.
Or at night, is that right?
Yeah.
Okay, all right.
And then we will counter check with the neighbors when can we catch the respondent.
Okay.
Yeah.
All right. And so what happens when you are actually with the household members? What kind of tests or what kind of questionnaires do you do?
Yeah, we do face-to-face interview using a tablet, handheld device. And then during the interview, some of the team members will do the anthropometric measurement to collect the weight and the height, half arm span, and the waist circumference, as well as the nurses will do the blood pressure measurement and then blood testing.
Okay.
Blood measurement.
All right. So how long does a visit usually take?
It's around 45 minutes to 1 hour. Depends on how many respondents on the house.
Right, because earlier you said if you randomly choose one household, you will interview everyone in the household. If you have 5 or 6 members, you would have to cover.
And then the interviewer, usually we have 3 interviewers. Mm-hmm. So if the household is more like 6, so the time will be double.
That's right. So 3 interviewers and you have a nurse.
And then a driver.
All right. Okay. Of course, to go around.
So 5 in a team.
Okay. And 70 teams going servicing the whole country.
Yeah.
70 teams doesn't sound like a lot.
Yeah, but they will go all out.
Okay.
We work very hard.
They will
Sure.
move from one area to area. So we develop a plan for them. So they will move from one EB. One EB is like enumeration block from one area to another area, and then they will not they will not going home for 3 months.
Right, yeah.
Yeah.
I mean, what happens if, the officers have tried those 3 times?
Yeah.
Either the respondents are not at home or they don't want to participate. What happens then?
After 3 times, we will consider them as non-respond. We will not. But after finish the 2.5 month survey, we will look again at the state response rate. If the response rate is not enough, we will try again to the house that refuse. So we try again to achieve, because we have a certain response rate need to be.
Yes, you have a minimum to achieve.
Yeah.
You wouldn't just sort of randomly reselect new households?
No.
We don't.
I see.
Yeah.
Okay. Have you had a situation where you just can't meet that minimum response rate?
Well, I think, thank God, so far, no.
No.
We have always been able to.
But sometimes we will replace the whole EB, the whole enumeration block. Okay, like sometimes in Sabah and Sarawak, we go to the area when the scouting detect that in Sabah, some part of Sabah, they have a very movable kampung, something like that. And then when they go, they will replace the EB, the whole EB, but not the respondent.
I see.
Even for the condominium, can you say that?
I know, we'd still include that.
Yeah.
It actually happens only in very extreme cases. Like what happened in 2015 was we had selected the areas that we wanted to go. And then, unfortunately, Kelantan was hit by a massive floods at that time.
Of course, yeah.
Yes.
Yeah.
So quite a big areas were totally wiped out. So this was really unfortunate for the people there. And of course, there was no one there for us to do a survey with. So then in that case, those kind of extreme cases, then we would select a whole new place.
Can somebody actually volunteer to participate in the survey?
No.
No.
They will be biased for the survey.
Okay. And speaking of bias, are there any parts of the interview that perhaps the respondents may have their own bias when they answer? Do they have to self-report? They have to self-report some health behaviors and practices, right? Like smoking and all that.
Yes. We rely on self-report from the respondents, from our participants.
So how do you deal with that if they underreport smoking, for instance?
Well, we have two methods of it. One is we do ask the questions. We train our data collectors on how to ask these questions, and we make it as comfortable as possible for them. We try to do it at a time that's convenient for them, where they are most comfortable and they would be more likely to be honest with us with their responses. And however, there are certain aspects that we considered maybe it's just not appropriate for us to ask this question. So we would then give them a paper where the respondents will then fill it up, put it into an envelope and seal the envelope and give it to us.
Right.
So this gives them a more measured confidentiality and an assurance that their results is indeed confidential. And we hope to get a better response and more truthful answers that way.
Okay, so you can individually submit that sealed response to the officers later on.
Yes.
Okay, but overall, how is all the data that's collected? How do you maintain the respondents' privacy and confidentiality? I mean, are things like our names and personal details included in the data that you collect?
Yes, we do collect all this information. However, the respondents' confidentiality is of utmost importance to us. We are very thankful that because this is a voluntary, they are taking their time to take part in this. And whatever information we collect, it is all entered into a handheld device, like how Encik Ali said, and it is then submitted to our server centrally located in Institute for Public Health.
Okay.
So this server, the data with any of the identifiers, is only accessible by a small team, not more than 5 people who have access to this server and this data. And subsequently, when we do analysis, when we crunch the numbers and come up with what we need to do, all the identifiers are then removed.
I see.
If other ministries, other agencies request for this data, usually because this is a public database, we have universities and other agencies requesting for it, we would remove all identifiers, anything that could anyhow connect this person with this place, then it will be removed before we send it out.
Okay. And what about language when your officers and the teams are doing the visits? Because obviously, we are in Malaysia.
Yeah. So basically, we are using Bahasa Melayu and English. But at some situation, because some teams doesn't have Indians or Chinese, we will get the interviewers from other teams to help, or who are able to communicate.
Okay.
Right. So we will have a contingency plan. So at least we try to get Chinese and Indian as well in the teams, even though it's hard to get.
Yeah. We keep the teams diverse so that because we understand Malaysia is multi-ethnic and we need this communicating in the language, especially with the older respondents, is very important for us.
And
sorry, if I can just elaborate on that. A few other things that we do is we actually contact sometimes the nearby local clinics in order for us to obtain help for someone who can speak that language, and sometimes even neighbors who can act as translators to us. So what's more important is actually, end of the day, is we are able to speak and get the information. And like how you said, being multi-ethnic, sometimes it's just impossible for us to cover all the languages.
But, all of that indicates that the respondents have to be open to doing this, and that the neighbors, sometimes if you need their help, the neighbors have to be cooperative as well. But I can imagine that sometimes I'm sure you face resistance. They don't trust your officers. They are wary of people trying to sell them things, or that is a scam. What kind of experiences have your field teams had?
Okay. Basically, when we go to the certain area, we will inform to the head of the chief of the area, and then inform the police station, and then before we go, even before we start the data collection, we do the scouting by our health personnel in the district. So they will go, they will distribute the pamphlet and all that, to get the early information, and then to inform them that we are coming, so that they are not assume us as a scam or something like that. And then even we promote. We are using media such as Facebook and all that to show them the proof. Even if they don't believe that, they can contact the police station.
Okay. I mean, what can people do if they really want to check that your field officers are genuine, really from MOH? What do you advise them to look out for? What kind of questions can they ask? What kind of identification should they ask for?
Okay, all our field officers, we have the name list of all of them already uploaded in our website and also in our Facebook page. So anyone with any queries, they want to double check, you can always see our official website that is listed there.
Okay.
Beyond that, our officers are also do carry identification card. They come wearing a vest. It's a light brown vest that we have from Ministry of Health. And they carry a tag with the identification, their photo, and a signature of our director at the back to verify the card.
Okay.
So, and beyond this, we also, like how Inshali said, we inform the police station the names of each of our data collectors and the vehicle that we use during this data collection.
Okay.
So if there's any queries by the public, they could get in touch with us, look at the website online, or even just contact relevant authorities.
Have your officers had bad experiences before?
Yeah, Very a lot. Sometimes we do interview in front of the gate.
Outside,
outside on the rain.
Oh dear.
But that's okay because we still get the data, right?
Okay.
But the hard one sometimes being chased by the dog.
But I think I have to say here, I mean, one of the things is generally the Malaysian public have been great with us. We are, most of the time people are very nice to us.
Okay.
Only
Some people are very
people,
nice. Some are just so sweet to us.
I've heard stories of people, the moment they hear the doorbell ringing or somebody knocking on the door, they close up everything.
Yes.
I think especially in urban areas, we are a bit more takut.
So that's why in the urban, basically we contact the head of the community. So basically when the head of community inform them, so we want the head of community inform the selected, and then this is to show us that we are the genuine. So they will confidence to open the door.
The head of the community could be the residents association for the area. Okay.
And the head of ketua kampung and all that. But basically kampung not a big problem. It's more in the urban area.
In the urban areas, I'm speaking to Dr. Shubash Shander Ganapathy, the Principal Investigator of the National Health and Morbidity Survey 2019, as well as Ahmad Ali Zainuddin, nutritionist. They're both from the National Institutes of Health. I've been trying to understand what the survey is, how it's carried out, and what we should do if one of the field teams comes knocking at our door to say they need to do this survey in our household. So when we come back, we'll just quickly wrap up with what do you do with the data after that, the number crunching part, what takes place there, and when can we expect the results of this year's survey to be released. So we'll be right back after the short break on BFM 89.9. Good afternoon and welcome back to the Health and Living Show with me, T. Xiao Ik. We are trying to understand the health and the National Health and Morbidity Survey 2019, what goes into conducting this survey and what do the results actually mean, how are they used at a national level for policy making. So in the studio with me today is Dr. Shubash Shander Ganapathy, Principal Investigator of this year's survey, as well as nutritionist Ahmad Ali Zainuddin. They are both from the National Institutes of Health, Ministry of Health. If you have any questions, you can quickly WhatsApp them over at 018-789-8899 or tweet us at BFM Radio. I think what I'd like to find out is because you are doing these simple tests to look for cholesterol levels, glucose levels, and blood pressure and all that, what happens if you discover an urgent medical condition among one of the respondents, like very high cholesterol level, for instance? What do you advise the person in that case?
Okay, if I may. One of the things that what we do is we go to the house and take the blood. This is actually something that is unique to National Health and Morbidity Survey in such a large scale in Malaysia. So when we notice that the blood sugar is very high, the cholesterol is high, and a very spiking high blood pressure of the respondents, for instance, like blood pressure, we ask them to rest, sit down, and we take it again. And that is the main reason why we have nurses in our teams. They are trained to also assess the situation. And furthermore, before data collection, our whole team, including the nurses, are trained again for the research methods. So this includes for them to be aware of what are the limits, what are the margins that we accept for our survey. And if it's higher than anything that's normal, we would then refer them to the nearest clinic.
Right.
We have also said that beyond a certain limit, then they would have to be we'll have to contact health services in order to bring them to a hospital.
Right.
Yes. So one of doing this blood testing, we also are able to detect quite a number of people who are previously never been told that they're not even aware that they have diabetic.
Undiagnosed. Yeah.
Undiagnosed diabetic. So like our previous report in 2015, we actually found that almost half the diabetics in Malaysians is undiagnosed. So this is actually a large amount and very important information for us. So this would then, in the health sector, step up our efforts into detecting these people and we want to get them early, start them on medication, and prevent the complications.
Yeah, and when we detect them, we will refer them to the clinics for.
Yeah, because does that happen very often that you come across people who urgently need that referral?
Yes, we do. Yeah, it's not say it's a lot, but we do get quite a number, and which is why we take the contingency plans for it.
Okay, all right. An interesting question here on WhatsApp. Is Malaysia no longer ranked the number one obese country? This person says in the world, but it was actually in the Southeast Asia, right?
Yeah.
Is Malaysia no longer the number one obese country in the region because our obesity has reduced, or are there just other countries that are worse than us?
Yeah. When we look at the data from 2015 data to the global health nutrition survey, and the data show is reduced from 17 to 13. But based on the nutrition survey, Global Nutrition Report 2016, I will not name the country. There are another country that the prevalence is more higher. But even though
is it Singapore? We'll be very happy if it's Singapore.
No, not Singapore. Other country.
Okay.
And then, but when we compare the nutrition report, also they state that the prevalence of obesity is 13. Instead of we are doing in 2015 is 17% of obesity.
So we have to look at prevalence as well. We're not just looking at ranking. The ranking is based on prevalence. Yeah. So this survey you're supposed to wrap up the data collection by the end of September of this year. What happens after that?
After that, the data is all. We do not have to spend too much time entering the data because it all enters our server through the electronic device, through our tablets. So we save a lot of time that way. Subsequent to this is when we would then analyze this data. We'd have to clean the data, make sure we remove all those impossible values and whatever that is. Usually there's a background noise that we collect together with this. We clean the data, we would then analyze the data, and we would then discuss with our stakeholders what does this indicate and what are our further actions regarding this. So we would then prepare our report, and this report will include all the results, all the states in Malaysia divided by major categories such as by gender, by their ethnicities, by their locations, and by states. And then we would produce this report usually within 6 months of completing our data collection.
Okay, within 6 months. Okay, so from the end of September, within the 6 months, the report should be released.
Yes.
Yeah, okay. We have a question here from Ganam on WhatsApp. What about anemia? Do you look at that in this survey?
Yes, we do. We do anemia. We take the hemoglobin level to detect anemia among all those who are 15 years and above in Malaysia.
Okay, all right. So we should be looking forward to something within 6 months of the completion of the data collection. But also, as I understand it, in the past few years, we've been doing smaller yearly surveys as well. Could you explain a little bit more about those surveys?
Okay, since 2011, we even though we do the National Health and Morbidity Survey on non-communicable disease and healthcare demand every 4 years, in between each year, we do carry out the National Health and Morbidity Survey. But this focuses on usually specific groups in which was determined by the stakeholders, by Ministry of areas of priority that we need more information or we need to understand their health status. So for instance, in 2016, we did the survey among mothers and with children who are under 5 years old. In 2017, we focused on school-going adolescents between 10 years old to 17 years old. And in 2018, we focused our survey on the elderly. So this is those who are 50 years and above. We took not really elderly, those who are going to reach the elderly age were also included.
Okay.
So 50 years and above were all included in the survey. So these are very specific groups that we would need further information on.
So then, because you're doing the 4 yearly one this year, does that mean you are not doing those specific groups for this year?
Yes, not for this year, correct.
But for next year?
For next year, yes. We would then proceed. Next year, we would focus actually on communicable diseases.
Oh, okay. All right. That would be very interesting, considering things like the vaccination, vaccine hesitancy that is becoming more common now. It'd be interesting to look at how that affects communicable diseases. Okay, so can you tell us how we can find out more about the survey, especially if people have been approached by the field teams and they want to, just to check them out to make sure that they're genuine? Can you give us some contact details?
Okay. If anyone has any queries, they can always visit our website. We have our Institute for Public Health website at www.iku.gov.my. /NHMS will give you all information regarding NHMS, regarding the people who are involved and our data collectors as well. They can also visit our Facebook page, our Instagram for details on this. And beyond that, public can always call our hotline. This is 03-3362-8734. This is our NHMS hotline to verify any information. This includes whether the car number plate, the people who come, are they genuine? Do they have any problems with these people? Please do contact us.
Right.
We would love to hear from the public on this.
Okay. So if they're unhappy with something that has happened during the visit, they can also call.
Correct, exactly.
All right. 03-3362-8734. Do you have a final message for us, Ali?
Yeah, non-communicable disease is a risk factor that are real. We are facing a real problem in the population. So the growing burden of NCD need to be stopped and reversed. Okay, and then NHMS is vital toward us evaluating our action, formulating new strategies, and increasing our current effort. And so this study is done not just for us, but chart the course for the healthcare for our future generation in Malaysia.
Dr. Shubash?
Yes, I would like to say that NHMS is just not another research. This is something that is very important for the Ministry of Health, for all the ministries in Malaysia to plan our health services, plan our health needs. And this is extremely important that we are able to get good information, adequate information. People are willing to give us cooperation and take part in this survey. So as a speaker for the NHMS team itself, I would really plead to the public to please cooperate with our data collectors who will be carrying their data collection between July to October all over Malaysia. So please cooperate with us so that we would get good response rates and be able to come up with good results.
Okay.
Yeah.
Thank you very much. I've been speaking to Dr. Shubash Shander Ganapathy, Principal Investigator for the National Health and Morbidity Survey 2019, and En Ahmad Ali Zainuddin, nutritionist. They're both from the National Institutes of Health with the Ministry of Health. You've been listening to The Bigger Picture on BFM 89.9.
Thank you for listening to this podcast. To find more great interviews, go to bfm.my or find us on iTunes. BFM 89.9, the business station.